My name is Terry Downs. I'm the Executive Director of the Program on Homeland Security at Middlesex Community College. There are a number of people who will be speaking, so we will get right to it. First of all, we want to thank the town of Tewksbury for hosting this event. We certainly thank everyone who's been involved in it, particularly Town Manager Richard Montori, who will now offer welcoming remarks. Manager Montori.
Good morning. It is a pleasure to host the Greater Lowell Health Alliance Regional Press Conference. And on behalf of the Board of Selectmen and the residents of Tewksbury, I want to welcome everyone here today. Thank you for coming. As we know, substance abuse, specifically opiate misuse, is a serious disease that is affecting each and every one of our communities. It is through the hard work and determination of many of the people in this room that we will continue to find methods of fighting this disease head-on. It is critical that we continue doing our part as individual communities, but more importantly, working together as a region if we stand a chance in fighting this battle.
Good morning, and thank you for having me here this morning. I'm really happy to join in this press conference because it reflects one of the three things which really is indicative of how we have addressed this issue up here in the greater Lowell area. And that is that we have looked at this problem, and I've been in law enforcement for over 30 years, and it has been rare to see a problem that has been so pervasive and so stubbornly intractable. Despite the resources that have been directed at this problem on the national, the state, and the local level, for a very long period of time, we continue to see the number of individuals suffering fatal overdoses growing. That has just recently begun to change a little bit in Middlesex County, and that is because of three things that are really different here. We have first of all taken a multi-pronged approach to this problem. That has helped us to sharpen our efforts in terms of what needs to be done, and it has helped us to be certain that we are not duplicating efforts as we have examined each proposal that has come before us and determined which of our 6 prongs it fits into. And those 6 prongs, the 6 lenses through which we have viewed this problem have been education, prevention, intervention, treatment, legislation, and enforcement. And that has helped us, along with all of the partners you see here today, to really address this in a different way. The second piece, and is very connected to that first, is the collaboration. It certainly would not have been the case, and everyone in law enforcement or social services knows this, a few years ago to see this group of partners come together to address this problem. And in the greater Lowell area, there have been no better partners than the folks you see here today. For the past 4 years, we have been coming together once a month, all sitting at the table, looking at this problem, and thinking about ways that we can address it. And that has led to us developing innovative programs that have really thought long and hard, not just about the problem immediately before us, a person in addiction right now.
Chief Taylor and his organization are doing a tremendous job, but unfortunately, like many other towns and cities across not only the Commonwealth, but the country, the numbers still continue to trend in the wrong direction. But the city of Lowell is working very, very hard, and is going to continue to work very, very hard until we get numbers under control. We have taken many, many great initiatives through the hard work of Manager Kevin Murphy, the Lowell City Council. We are working on mandating opiate education into the Lowell Public School curriculum, and I'm proud to say by the end of this school year, we will have opiate education into the curriculum on both the elementary and the high school level by the end of this calendar year. So we're very, very proud. We'll be coming out with an announcement in due time on that issue.
As Councilman Belinda did eloquently, I'd like to take this opportunity on behalf of Chief Dan Rose from the Berwick Police Department, Chief Neil Willett from the Drake Police Department, Chief Jim Spinney from the Chelmsford Police Department, to offer us sincere appreciation for the kindness and the support we've received from the Greater Lowell Health Alliance, specifically the Executive Director, Kerry Downs, that you just heard from, and the Administrative Assistant, Christine Sundara, who happens to be also present in the room here with us today. Through the support of the Tewksbury Police Department, the Berwick Police Department, Chelmsford, Drake, and other community resources during the periods of vulnerability is at its highest level. Ultimately, bridging the gap between treatment providers and community partners, this initiative will increase awareness and education around behavioral health issues, including substance use and mental health illness. It will increase access to treatment and reduce recidivism. The Regional Jail Diversion Program through Lady Health Behavioral Services clinician will provide services to the community members at risk who are identified by the law enforcement agencies and their families when they call looking for services. The clinical services will include assessment and referral, individual, group, and family treatment, consultation, linkage to family substance use screening and other services, family sessions, and appropriate therapy. The clinician will coordinate interventions with community providers, delivering services to the individual and/or family. Other clinical services will include parental and family guidance, inclusion of transition, discharge planning, and linkage to community services and supports, parent education, and instructional modeling. The Regional Jail Diversion Program will participate in monthly meetings with law enforcement, coalition, other community members, groups to promote the use of resources, family outreach, and build community supports. The last thing I would just like to say, I would be remiss if I didn't express how proud I am to be working in the Greater Lowell area with DA Marion Ryan and all of the individuals that you see standing up here before us. It's just, everyone has developed a cooperative spirit and are committed to working together on creating solutions to this epidemic that has plagued this area. This, of course, is obviously evidenced by all of the people that you see standing here before you. We have health departments, police departments, fire, emergency medical services, people from the court system, independent clinicians. It's incredible how excited everybody is about trying to make an impact, trying to reduce the numbers that we have here. Thank you very much.
And what I think it shows here is we have really developed a collaborative and cooperative spirit among the various agencies and organizations in our city. From a police department perspective, our efforts are focused in 3 areas: prevention and education, treatment and outreach, and then certainly enforcement. This particular grant will allow us to provide additional resources, additional efforts in terms of our outreach and treatment perspective, and that's the co-op program. So I am very happy. This is a great day, and I'd like to thank the Health Alliance, the Greater Lowell Health Alliance, for their contribution here. This will go a long way towards allowing us to put more resources, get to more individuals that need help, and get them when they are at the most receptive to treatment shortly after an overdose, which is really what this effort is designed to do, and trying to do everything we can to get those individuals into treatment, and not only save those individuals, but try and help their families.
A few years ago, we took on an initiative and had made one of our school improvement goals, the focus being building and maintaining strong adult student relationships. We've had an advisory program at our school for the past 3 years, where once a week we'd get together with our students in advisory in small group and try to strengthen those relationships, make connections with kids. Our thought process is, if kids feel connected to somebody or something at school, they're more likely to be successful academically, but more importantly, they're more likely to turn to an adult, a trusted adult in a time of need. So with that being said, we've had the advisory program for 3 years, but we're kind of moving away from a separate advisory program, but really want to offer PD for the full staff, where, advisory isn't only a 30-minute, part of the day. Now what I want to see when we go into a classroom is we want to see staff members, recognizing the developmental designs, principles of a middle school age student, where they have 4 basic needs. They have a need to feel competent, a need for autonomy, a need for relationships, and also a need to have fun.